One situation that you may have to deal with is when someone is choking. Choking is divided into two main groups, mild choking and severe choking. Mild choking is where you have a blockage in the throat, however air can still pass through. So this person will cough, breathe heavily and be distressed, but air can pass through. So you may hear them making a noise, coughing, or they may be able to talk. An example of mild obstructions could be a fishbone caught in the throat. The procedures are to try and calm them down as best as you can, allow them to cough, and hopefully they'll expel the object. If they don't, then you will need to get them to medical help and call the EMS, because you will not be able to remove the obstruction from their throat. The other group is a severe airway obstruction. A severe airway obstruction is a complete blockage in the throat. This often happens when people are laughing and talking or eating at the same time and rushing their food. If the lump of steak gets stuck in the throat, no air passes, and this will be a severe condition. They're not going to be able to cough. They're going to be very distressed and they'll pass out in a short space of time, in just over a minute. With this person, we must approach them and get their consent. One of the things we can say is ask them, "Are you choking?" It might seem odd to say, but the reason you're saying, "Are you choking?" is we want them to get a reaction from it. If they say yes, it means they're not choking in the sense of a severe airway obstruction. If they cannot answer you, you'll have to look for other signs. They may nod, give hand gestures, or show you signs of distress, but will not be able to talk or make noise through their mouth. The universal sign of choking is when the casualty places their hands on their throat. In this situation, consent cannot be verbal, but they will show signs that they will need your help and consent to your help. We are going to perform two key procedures. The first one will be 5 back slaps, and the second one will be 5 abdominal thrusts, and then we'll repeat that if the obstruction has not been removed. Once you know the person is choking, stand behind them with one arm around their waist to support them if they were to fall unconscious. With the other hand, deliver 5 back slaps with the heel of the hand between their shoulder blades. After each slap, quickly check to see if the obstruction has not come out and deliver the next one. If the 5 back slaps do not work, then you'll need to deliver 5 abdominal thrusts. Place the thumb side of your fist just above the belly button and below the rib cage, and then place the other hand on top and deliver 5 thrusts inward and upward. After each thrust, quickly check if the obstruction has come out and then repeat. After the 5 thrusts, repeat with 5 back slaps and 5 thrusts and then 5 abdominal thrusts until the obstruction comes out or they become unconscious. If this is successful, allow them to breathe and get them checked by medical professionals, as this procedure can cause serious injuries. If they become unconscious, activate the EMS if not already done so and start CPR at the chest compression stage. CPR may allow trapped air in the lungs to expel the object. Finally, if you had to do the abdominal thrusts on someone who's pregnant, then you cannot thrust on the stomach, so you would do what's called chest thrusts. This would be exactly the same as where we do CPR compressions in the middle of the breastbone.